Recently on the news, there was this woman, she passed away. She had so many different procedures, and off the top of my head, I don't remember all of them, but I do remember that there was a blepharoplasty, so that means eyelids being done. She was having chin lipo, I believe. Then she had a breast lift, and then a tummy tuck, and I think there was a couple other procedures, maybe a rhinoplasty. Regardless, it was a lot of different procedures, and it was a lot of procedures to be done under local anesthesia. Now, what is the difference between local anesthesia and general anesthesia? In layman's terms, because I am not a surgeon, so please always inquire with your surgeon or your doctor before doing anything. Do not take me as literal advice. Local anesthesia is an anesthesia that's going to be injected locally. So it's going to be injected like directly in the site. And it's done. You can do it in office. You would be awake throughout the procedure. So you would be awake. You can take Xanax. You can take some type of medication that's going to like just curb your anxiety. For the procedure, you will be kept relatively numb, and it should be a painless experience. You will feel pressure, like the pressure of the surgeon, like whether it's liposuctioning, you're gonna feel like a pull. But you're gonna be taking some type of pain pill, anxiety pill, something, so then you aren't gonna be whole aware of you're not going to be completely focused on what the surgeon's doing. Let's hope. A lot of surgeons, you can do facelifts. These facelifts, it's going to be more just skin lifting, like skin excision. It's not going to be a whole lot of like deep plane facelift. If a surgeon, side note, if a surgeon's saying that they can do a deep plane facelift under local anesthesia, run. Procedures, you can do like fat transfers, so like a BBL, liposuction under local anesthesia. The one thing with local anesthesia is the surgeon has to be mindful of how much lidocaine they're injecting in your body, because there's this wonderful thing called lidocaine toxicity. Now, lidocaine toxicity, there's a lot of things that can happen with it. One of the major things is death, possible death if you have too much lidocaine in your system. So this is where a lot of surgeons, you can't do 10 procedures in one shot, because you have to make sure your patient is safe. Patient safety is the number one concern, or at least it should be. It's sad that it's not. And money is the main concern for these surgeons. You want to keep the procedures relatively minimal. It's not like you're going to be doing 10 procedures under local anesthesia. There's whole calculations, like how to figure out to stay in a safe place with patients' BMI and everything like that with local anesthesia. Whenever you're having bigger procedures, this is why they recommend twilight sedation or general anesthesia, because you're not going to have lidocaine toxicity with that, because you're put to sleep. They can do the procedure and they don't have to worry about that. With being awake, you have to be kept comfortable, because if not, you're going to be screaming. So that means they have to give you a lot of lidocaine, so then you're comfortable and you're having a comfortable experience. So this doctor, he ended up doing all of these different procedures on this poor patient, and this woman, she ended up passing away because of lidocaine toxicity. And it's so sad. It's so unacceptable. That's something that whenever you're having procedures done, you're making the decision and like trying to figure out what you're going to do, really look into it. Just because you're going to a doctor, surgeon, yeah, we hope that your safety is their number one priority, but it's not. It's not always the case, and that's so sad. But you do need to do your research and verify these things, because if that patient had asked some questions and like, okay, why are we doing all of this? Can we hold off? It's when you get into that state of almost like manic state where you want the procedure done now, you want it immediately done, you don't care. That's when you get into safety issues. People start forgetting things. A lot of the medical clearances, the tests that need to be done, people start forgetting about them because it's a quick money grab. People want to get the money. The surgery, the doctor's office is an office. They have goals, they have monetary amounts that they're needing to meet. So you have to be mindful of these things. They're businesses as well, as unfortunate as it is. So if you come in there and you're like, hey, I want this, and this, and the surgeon can do it and they have that free time, they're going to do it. They're going to do it. And heaven forbid that your safety's put in jeopardy. So no one's going to advocate for yourself. I always say this. No one's going to advocate for you. So be your own advocate. Ask all the questions. Find out what other options there are or other alternatives. If it's best to wait 6 months before having another procedure done. Sometimes doing it the safest way, you can honestly wait like 2 weeks, 3 weeks, and you can have another procedure done. It's not the worst thing in the world. Why not? Why wouldn't you wait? Or why wouldn't you spend a couple grand extra and have it done at a surgery center versus doing it under local anesthesia and passing away? It's little things like that where, yes, local anesthesia is cheaper because guess what? You don't have to pay for anesthesia. You don't have to pay for the surgery center, the entire fucking staff. Anesthesiologists are normally like $500 an hour. And if you're in there for 4 hours, it gets expensive. And then the facility fees and this and the other, blah, blah, blah. I know, I do this for a living. I hear it all the time. But I'm sorry, the extra like $4,000 or $5,000 that you're spending on anesthesia is so worth it. Your life, $5,000. Yeah, just do it. Fucking open a care credit line, put it on a credit card. If you're that manic and you need to have the surgery that quickly, make sure that you're around to enjoy the results. How about that? That may be, that's an idea. Be smart.